Okay, well, thank you so much for having me here today. I'm really delighted to be presenting to Cal Southern. The title of the presentation is Becoming a California Licensed Psychologist. So we're going to cover the nuts and bolts of what's required to become licensed in California. A portion of this workshop will apply if you're getting licensed elsewhere, but particularly all the material related to the EPPP, Exam for Professional Practice in Psychology, which is a national exam that you have to take regardless of what state or Canadian province you're in. So that will apply to anybody all over the country or throughout Canada. But we're going to talk about the nuts and bolts of becoming licensed in California and what some of the additional requirements are in addition to the tests that you're going to need before you can be licensed. I'm pretty passionate about licensing and preparing people for licensure and the importance of having a license. I've just seen so many people over the course of my career see their careers blossom once they had the license in hand. So, congratulations to all of you who already have your doctoral degrees, but I would really love to encourage you all to pursue the licensure process. It really opens up a lot of doors and opportunities. All right, so let's go ahead and get started. To actually get your license in California, there are 4 qualifications that you're going to need. So here are the 4 criteria. The first, which if you're a student at Cal Southern, will be to acquire your doctoral degree. The second requirement is, interestingly, which we'll talk about in just a moment, California requires a small subset of additional coursework that you will need to take before you can get your California license. You will also need to have supervised professional experience. We'll talk about the number of hours and how you accrue that. And finally, there are examinations that you're going to need to pass. There will be a total of 2 of them that you'll need to get through. All right. So the doctoral degree would be a doctorate in psychology, counseling psychology, or educational psychology. Coursework. These are a number of courses that need to be completed prior to licensure, and we get this question very often, which is, do you have to complete these courses before you get your doctorate degree or before you could sit for the examinations? And the answer is no. You can complete these specific courses any time before you get a license. So what that means is that you're allowed to take your examinations before you've completed these courses. These will not taking these will not stop you from being able to sit for your exams. However, you could take your exams and pass them. They won't give you your license until you've met these course requirements. Some of them may, in fact, be offered as part of the Cal Southern curriculum. Many of them are offered, so they're very quick and easy to take, and one of them, I believe, you have to take live. So the first one is substance abuse, and that needs to be a semester or quarter in length, or it can be about 15 hours. So there are some programs that offer a 15-hour substance abuse. They call them pre-licensure workshop. Human sexuality is a minimum of a 10-hour requirement, and again, you can either complete that during your graduate training or aside afterward. Child abuse, the requirement is 7 hours of training. Here's an interesting one, spousal or partner abuse. What's interesting is that the requirement depends on the amount of hours, depends on when you began your graduate training. So if you began your graduate training on or after January 1st, 1995, you need 2 hours. If your graduate training was before then, you don't need any hours. However, if your graduate training was begun on or after January 1st, 2004, they up that from 2 hours to 15 hours. So for any of you who started your training after January 1st, 2004, you're going to need to meet the 15-hour requirement. The final requirement is exclusively for people who began their graduate training on or after January 1st, 2004, which is 10 hours in aging and long-term care. So if you began your graduate training before then, there is no requirement for aging and long-term care. Okay. Supervised professional experience. The California Board of Psychology requires a total of 3,000 hours of supervised professional experience that needs to be completed. They actually allow you to, you could do 3,000 hours straight, or you can do 1,500 hours, submit that, and do another 1,500 hours. One of the really important requirements that sometimes people overlook and gets them in a lot of trouble is that each of your 1,500 hours have to be completed within 30 months, so within 2.5 years. What that means is that if, let's say you've completed your first 1,500 and you go to complete your second 1,500 and you do 1,000 hours, and then you take a break from psychology for whatever reason, to raise your family or due to an illness or something of that sort, and return to complete those hours 5 years later, unfortunately, that subset of those 1,000 hours will no longer be counted because they have to be 1,500 hours within a 30-month time frame. So very important consideration as you think about accruing your supervised professional experience. The other interesting requirement is that of the 3,000 hours, 1,500 must be completed postdoctoral. So what that means is that even if you complete 3,000 predoctoral hours, certainly people who do APA internships complete anywhere from 1,900 to 2,100 predoctoral hours, they will only count 1,500 of those. Then you must complete the remaining 1,500 hours postdoctorally. And there are a number of ways that you can accrue these postdoctoral hours. One is to be an employee in an exempt setting. And exempt settings are any government facility or most educational institutions. So if you're actually hired in postdoctorally to, for example, work at UCLA, USC, at the VA, at the prisons, that would be an employee in an exempt setting, and you can accrue your hours. You can also accrue your hours as a registered psychologist. To be a registered psychologist, you actually have to register with the Board of Psychology before you can start accruing your hours. What I didn't say is, as an employee in an exempt setting, it's very interesting. You don't have to let the board know in advance that you're starting to accrue your postdoctoral hours. You don't have to get registered at all. But as a registered psychologist, as the name sounds like, you do need to get registration, and registered psychologists specifically are authorized to provide services. They're specific to nonprofit community agencies that receive a certain amount of funding. So you'll know if you're working at one of those agencies. You can also accrue your postdoctoral supervised professional hours as a psychological assistant. And in order to do that as well, you will need to register in advance with the board to be a registered psychological assistant to either a licensed psychologist, board certified psychiatrist, psychological corporation, or psychology clinic. So you need to submit your registration and you need to be approved. Just a word on timing. The board works very diligently to process things as soon as possible, but they are employees of the state of California, so they're very short-staffed. So there can be a wait. It can take 8 to 10 weeks, for example, to get your psych assistantship or your registered psychologist paperwork approved. Just something to know. So that's something you want to submit far enough in advance if you do have that opportunity. One of the interesting clauses is that, if you'll notice here, you can be a psychological assistant to a board certified psychiatrist. You cannot be a psychological assistant to an MFT or LCSW, but the psychology board does allow you to be an assistant to a board certified psychiatrist. However, they limit the number of hours to 750. So 750 of your postdoctoral hours could be accrued under the supervision of a board certified psychiatrist. So keep in mind, even if you do all 1,500 with that psychiatrist, they will only count 750 of them. So you're going to have to find another supervisor to get the remaining number of your hours, and it's going to have to be within that 30-month window. All important considerations. Okay, so those are kind of the nuts and bolts, and this is what we're going to spend a lot of our lecture on today and our discussion on are the 2 examinations that are required for you to become licensed. For most people, the first 3 that we discussed aren't really the significant issue. Sometimes it is difficult maybe for people to get their supervised hours, but it's the examinations that really seem to slow down the process for some people. And so I want to talk to you today about the nuts and bolts of those exams, and my hope is really to convey the message to you that it's a very doable process. A lot of people are intimidated. It's a big process, but it's a doable process. So there are 2 examinations, one we affectionately call the EPPP, or the EPPP, or the Examination for Professional Practice in Psychology. As I mentioned, that examination is not specific to California. It's offered and it's required to get licensed in every state and every province in Canada. The good news about that then is that if you take your EPPP anywhere else in the country or in Canada and later decide to move to California, the scores are easily transferable to California, and most states and provinces have the exact same cutoff for passing. So we'll talk about the California cutoff soon, but it's almost universal that all states and provinces have the same cutoff. So for a small fee, you get your score transferred to California, and then that exam is out of the way. One thing that sometimes people ask is, here's our next exam, the California Psychology Supplemental Exam, the CPSE. Okay, backing up to the EPPP, well actually, yes, backing up to the EPPP. As I said, you could take that as long as you're eligible anywhere in the country or in Canada. And there's no time limit on when that exam expires. That's what I'm trying to say. So if you take that exam in 2011 and do nothing with your psychology career for the next 20 years and then want to go back and get licensed, those scores are still good. You will never have to take the EPPP again so long as when you took it, wherever you took it, you got the cutoff score. Okay, we're going to talk about a number of very important issues with regard to the EPPP and really try to simplify the process for you guys. And again, you have the PowerPoints. You can listen to this webcast again. There's a lot of information we're going to go through here, so again, you can refer back to it at a later point in time. Starting with, we're going to talk about application process and the fees. So where do you apply? When do you apply? How much is this all going to cost? Test administration and scoring, we're going to discuss who administers the test, what are the areas that the test covers, how is this test scored, what's the cutoff for passing. Oops, go back, thank you. There's a technology glitch. Areas of emphasis. So the EPPP will talk about the people who have designed the test have broken it down into 8 areas of emphasis, and they're weighted almost equally. We're going to talk about what's new, any upcoming changes to the EPPP. There are a couple of pretty small changes scheduled to take effect August 1st, 2011. I'm going to give you some statistical information that's published by the people who put out the EPPP in terms of passing rates and things of that sort. We'll talk a little bit about what PsycPrep offers for test preparation, and there are other test preparation companies as well. And the last thing that we'll touch on with regard to the EPPP are strategies for success. So again, for those of you who aren't going to be graduating for a number of years, this may seem like, well, we're way ahead of things. But for those of you who are thinking of taking the EPPP very soon, the strategies for success that we're going to really just touch on here is a huge part of that 5-hour introductory workshop that Dr. Grimes talked about that we offer at PsycPrep. It's a free workshop, and we really spend 5 hours talking about what are those strategies to succeed on the EPPP. So we'll touch on them here, and then of course you're all invited at any point in time to join PsycPrep in that workshop, and hope to be back here presenting that one as well. Okay, So starting with item 1 from the EPPP, application process and fees. If you're applying in California, you're going to be applying to the California Board of Psychology. You have the website and the link to the Psychology's board website. If you're applying in another state, very easy to find your own state board. Okay, so we start with what the BOP calls their application fee, and that is simply their fee, $40, that they're going to charge you to process your application. In order to take the EPPP, these are the 2 requirements. You must have completed your doctoral degree. So your school will need to submit proof of your doctorate degree to the California Board of Psychology. You'll have to fill out your application. You must have completed 1,500 hours of your SPE hours. Okay, so some students complete the 1,500 hours pre-doctorally. So while they're accruing their doctoral degree, while they're working on their doctoral degree, they do an internship and they accrue 1,500 of their hours, which means that the minute they get their doctoral degree, essentially they're eligible to sit for the EPPP. Students who do not do any pre-doctoral hours, and I'm actually not sure, does Cal Southern require pre-doctoral clinical hours or not at this point in time?
No, they require practicum, but
not pre-doctoral hours. Okay, so for some students at Cal Southern, if you're not required to do any pre-doctoral hours, all your 3,000 hours will then be accrued postdoctorally. And so you'll be eligible to take the EPPP as soon as you've completed your first set of 1,500 postdoctoral hours. Okay? And if you're working full-time, that's actually less than a year. So you can get it done pretty quickly. What happens once you submit your application is there are licensing analysts at the Board of Psychology, and they'll randomly assign alphabetically based on your name or when you sent in your application to one of the licensing analysts. The licensing program coordinator currently, those things can change, although she has been the coordinator for quite a number of years and she's very helpful, is Lavinia Snyder. I've just listed her name and her phone number in case anybody is currently running into any issues. So here's what happens. You submit your application along with proof that you have your doctoral degree. I didn't mention you're going to need to submit live scan fingerprints as well, your $40. Your supervised professional experience forms, your supervisor will submit that. And then hopefully all goes well and the board BOP determines that yes, in fact, you've met the EPPP eligibility requirements. What happens next? They'll let you know, so they will send you an email saying you have met the eligibility requirements, you're good to go. And then they will forward your name to an organization in New York called PES, Professional Exam Services. So you don't have to make contact with PES. The board will do that for you. They will submit your name to PES. PES is the company that actually oversees the administration of the EPPP exam. So they're kind of like the testing gurus for the whole country. And they have oversight over the development and administration of the EPPP. So your name and email will be forwarded on to PES in New York. And then you get a very nice invitation from PES, an online invitation by email to invite you to test. So you're hereby invited to test. Okay, so here comes the next fee. The testing fee to take the EPPP, which you're going to be paying PES, at this point in time is $450, and you will be paying that fee online. Once you've paid your fee, you answer a couple questions online, pay your fee. Within a few days, you will get another email from PES with what they call your authorization to test. So they'll say, now you're officially authorized to test. They'll give you an authorization number. And I'll talk about what you're going to do once you're authorized. But this is a very important piece of information. The whole timing of applying to take the EPPP can be a little bit confusing because it's a two-step process. First, you have to apply to the California board. Then you have to apply to PES and send in the money. what I would like to encourage everybody to do is make your application to the California board as soon as you possibly can. So the minute you have your 1,500 hours and your doctoral degree, I would encourage you all to submit your $40, your application to the California board, because that can take 6 to 8 to 10 weeks for them to process. The mistake some people make is to think that this whole thing will happen very quickly. PES actually happens very quickly, but the California board may not. So what we found is that some of our students get 95% through the study process, apply to the California board, only to find out they now have to wait 3 more. They were wanting to test next week or the week after, finding out that they have to now wait 3 months before the board's going to approve them. So I encourage you all to go ahead and apply to the board as soon as you're eligible. What happens then if you apply and you don't take the EPPP for a while? That does not seem to be an issue. So when the board approves you, they give you a full year, but also if you take more than a year, they're very generous about allowing you to extend that. So it's not a big deal. You just tell them, I applied a year ago, you approved me, or a year and a half ago, and they go, fine, you're okay. Here's the other timing issue. Once you send in your money to PES, your $450, there is a clock that starts to tick. It's the 60-day clock. What that means is that you need to test from 60 days from the date that you get your authorization to test email with your ID number. Okay? So you're going to be testing at Prometric testing centers. At least this is the current place and has been for a number of years. There are many, many testing centers throughout the country, throughout Canada, a lot of them in Southern California, if that's where you're located. The test itself, many years ago, if you know people who were licensed years ago, the EPPP exam was only offered twice a year. And once it was Southern California, once it was Northern California. The good news is with everything being computerized, once you're eligible to take the EPPP exam, you'll make contact with Prometric, and you get to choose when you're going to take it. That's the upside. Evenings, weekends, the day of the week, the day of the month, you get to choose, all up to you. That's the upside. The downside, which it's not on a slide in the presentation, but I always want to warn people. It is amazing how we've been doing this a long time, including, for many years when it was only offered twice a year. And when it was offered twice a year, people would commit to the classes. The classes would end like 2 weeks before the exam, and about 98% of the people would go on to take the test. So basically, in 4 to 6 months, everybody would be done and would take the exam. Now that it's open-ended, we have people who take a class and they don't test for 2 years or 3 years or 5 years. So I do, because there's no deadline. It's so amazing how this every 6-month deadline hanging over people's heads really, really encouraged people to get it done. And they would do it. And now people kick themselves because years have gone by since either they graduated or they took a course and they just didn't feel they were quite ready, and so time goes on. So I do want to encourage people to really set yourself a schedule. That's going to really help. So you can schedule the exam anytime Prometric is open. Prometric charges their fee for using their testing site, so that's a $65 fee. What I didn't say is, backing it up a second. Oops, sorry. Oh, I backed it up too far. Sorry about that. Moving on. Is about this. The 60 days. What happens if you don't test within the 60 days? It's not the end of the world. You don't lose all your money, but you do lose a subset of your money. So, but it is a pain, because then you have to reapply to actually the California board and re-deal with the whole thing with PES. So you want to send in your money when you know you're ready. Okay, let me skip over this really quickly. Test administration and scoring of the EPPP. The EPPP, for the most part, we'll talk about when it isn't, is a computer-administered test. And there are 225 4 choice, multiple choice questions. And on these questions, there's only 1 right answer and 3 wrong answers. There is no partial credit for like the second best answer. People wish there were. Of the 225 questions, 200 are scored items and 25 are pilot items that are unscored items. However, you, the licensure candidate, have no idea what the pilot items are and what the scored items are. We get people with all kinds of very intricate theories about which the pilot items are, but I think they're probably all inaccurate theories. So you want to take every test item as if it counts. You have no way to know. When will your score be available? You think, okay, I took it on the computer. Shouldn't it be available right away? The answer is no. Well, maybe it should, but the answer is it's not available right away. The scores from a given grouping of people, the scores are available twice a month. And what they do is they group all the licensure candidates who take the test from the 1st to the 15th. And they're all in one cohort. And they do their magic with your test scores and your test numbers. And a few days after the 15th of the month is when your results become available if you took your test in the 1st to the 15th grouping. If you took your test from the 16th through the end of the month, your test data, your results, are available a few days after the end of the month. How do you get your results? They send you an email saying, click this link, put in your username and password, and your results are available. One of the most interesting things is they tell you how you scored, but they don't tell you if you passed or failed. Because they're just giving you your score, because it turns out in some states you can get, there's a different cutoff if you're going to get licensed at the master's level. So they're not smart, I don't want to say smart enough, but they're not specifically telling you whether you met the California cutoff or the 450 cutoff in a different state. So we get calls all the time from people going, I got my results. Does this mean I passed or not? So in California, which we'll talk about, you need a 500. The cutoff for passing is 500. So, oops, did it again, sorry. Okay, I'm going to learn how to use this clicker. What I wanted to say about this is that if you're somebody who really doesn't like waiting, you can time to take your test either like right on the 14th or 15th or the last day of the month, and you'll only have to wait 2 or 3 days. So if that's a big factor, you know, most of the time people take the test when it's convenient, but if you just can't stand the thought of waiting 2.5 weeks, just take it on the 15th and you have almost instant gratification. Okay, the test itself, 225 items, just going to check on time here. You have 4 hours and 15 minutes to complete your 225 items. That comes out to about 1 question a minute. Here's what's interesting. All the state boards and provinces are required to make reasonable accommodations for any individual who has a disability that would interfere with them being able to complete the test in that 4 hour and 15 minute time frame. So they don't accommodate people with disabilities by saying you can have a lower cutoff. The cutoff is still the same. They don't say we will accommodate you by giving you a dictionary or no, none of that. But they will accommodate you by extending the time for the test to most commonly 6 hours and 15 minutes. So if you have a physical or mental limitation, a physical limitation, for example, someone who has chronic back pain and they have to keep getting up and down, you know, every 5 or 10 minutes from their seat, they can't stay seated for extended periods of time. Obviously, that's going to take time off the clock as they're taking the test. So for those kinds of reasons, you can get a reasonable accommodation. If, for example, you have a diagnosed anxiety disorder or learning disorder or ADHD, they will give you extended time as well. The California board is very generous about this. There's a form that you'll fill out, that you download from their site, that you would fill out, and that you would have a doctor fill out as well. I've never known them to turn anybody down who has a legitimate reason for reasonable accommodation. The other issue is occasionally people will need an accommodation with a paper pencil version of the test. that would include somebody who has vision problems that would make it difficult for them to read things off of a computer screen. I've known some blind psychologists who do it in a paper pencil format with a reader. So they're very good about accommodating people. Let me back up. Oh, I hate when I do that. Okay, sorry. The last thing about the accommodations is if English is your second language and you've been in the country less than 10 years, you can have an accommodation in which you can take the test in more time, 6 hours and 15 minutes. Okay, that is the only accommodation. So they don't give you the dictionary or any other thing, but you can take the test in more time. If you've been here 10 years and a day or longer, they will not accommodate you with this particular accommodation. Okay. Scores on the EPPP. Scores range from a low of 200, I assume that's if you leave your test blank, to a possible high of 800, although realistically, really high scores are in the low 700s. It's just virtually impossible to get beyond like a 725. So there's no way you can get an 800. Unlike, the SATs where people get perfect SAT scores, this is just not possible on this test. So don't strive for that. No, you just want your 500. But it is nice to get a high score. In California and most states and provinces, the cutoff for passing is 500. Oh, sorry. I'm still getting used to my little clicker here. Let's try this again. Okay. A score of 500 is roughly equivalent to a 140 raw score out of the 200 scored items. So remember I said earlier there's 225 items. 200 of them are scored. And you need about a 70% to be right at 500. In the event of failing the exam, which we discourage, and I'm sure you guys discourage as well and don't want to have happen, the important thing to keep in mind is there's no waiting period to retake the EPPP. Basically, you notify the board and you'll quickly get another one of those invitations from PES to take the test again. In California, the EPPP, I know you're probably looking at this and groaning, can be taken up to 4 times each year. In California, there's no limit on the number of times you can take the EPPP, which is really different. In some states and some provinces, I don't know what happens to people, but you can only take it 3 times. And then that's like the end of your amount of times to take the EPPP. We've literally had people who had used other programs for their first 2 times and gotten the psych preparation program, and they are under big stress because it's like, well, and I don't really know exactly what happens to them, but it's like they cannot get licensed if they can't take the test in their state or province after the 3rd time. So California is very generous about that. Some other states and provinces are not, so you want to check depending on where you're located. Okay. Areas of emphasis. The developers of the EPPP, what I didn't say is the organization that actually has the entire oversight over the EPPP is an acronym. It's called the ASPPB, Association of State and Provincial Psychology Boards. And they have divided the EPPP into 8 areas of emphasis based on very rigorous studies and surveys of what psychologists in the field do and what percentage of the time they spend doing different kinds of things. These are the current areas of emphasis, which have been the areas of emphasis for many years now, and the current percentages with numbers of questions assigned to each of the areas. The areas are pretty even in terms of how they're weighted. And I'll take a moment to just discuss the different areas with you. Some of the areas are, when you go to study for the EPPP, are very circumscribed areas. Other areas, for example, the first one of assessment and diagnosis, really covers about 3 completely different graduate level psychology courses, which I'll discuss in a minute. So that would be like 3 different areas. When you get your study materials for the EPPP, whether you're using PsycPrep or another company, they will not be divided like this because, for example, oh, I hit the wrong one again. Okay. I should have brought my own clicker, which I'm used to. For example, assessment and diagnosis includes all the test questions related to DSM diagnosis. It includes all the test questions that have to do with test construction, reliability, validity. It also includes all the test questions related to assessment instruments that we're familiar with, the WACE, the MMPI, the WISC, the Rorschach. So you can see that this one area, as I said, covers 3 or more graduate level courses. And so those would be separated out in your materials. But there'll be a total of 28 questions in assessment and diagnosis. Biological bases of behavior, that's all the brain behavior and includes medications, is 11% or 22 questions. Cognitive affective is also kind of a broad mixed area. It includes some things related to industrial organizational psychology, theories of motivation. It includes things related to memory. They tend to ask a lot of questions about memory. And lastly, it includes learning theory, so classical conditioning, operant conditioning. So again, quite diverse areas, all considered part of the cognitive affective bases of behavior. Ethical, legal, very circumscribed, most of the questions related to applications from APA's ethics code. Growth and lifespan, developmental, that's also very circumscribed. Research methods. Research methods includes statistics and research design, but excludes test construction. So your questions from test construction will fall in this category. Research methods are just statistics and research design. And the final area are social multicultural, also pretty circumscribed. Now, as you look at this list, you may be thinking, especially if you've already graduated, that wow, some of this was definitely covered in my graduate school and some of this was not. Do I need to go out and take extra courses? Do I need to go out and get supplemental reading materials on these classes? And the good news is the answer is no. So even if you have had none of these, of course that wouldn't be the case, covered in graduate school, the whole idea with a test preparation training program is that you're given the materials, the study content, maybe some CDs or workshops that will really give you all of this information that you need to know for the EPPP. So you do not have to go out and take extra courses or workshops or get books or anything of that sort. It's all circumscribed in your test preparation program. Okay, wait, that last area. There's got to be a better way. Okay, the last area was treatment intervention, and that was 30 questions. Okay. There are 4 forms of the EPPP in circulation at any given point in time. So what that means is that if you test today, you might get Form A, you might get Form B, you might get Form C. You never know which form you're going to get. The important issue is that the emphasis that we just discussed for each of those content domains is required by law and ethics to be the same for every form. People will have a lot of anxiety and say, what if I get the form that's all statistics questions, because that's my weak area. There is no form that's all statistics questions. The test developers are required, and they're very meticulous about this, that these percentages are identical for each form. That's one of the ways they keep the whole testing process fair and equivalent. I already mentioned that the domain of assessment really consists of, it's predominantly DSM and test construction questions from the feedback that we get from people, but a smattering of questions on test instruments and maybe even some I/O things. I talked about research methods and stats. Industrial organizational psychology. That tends to be a challenging area for a lot of people, especially if your degree is much more clinically emphasized. Many graduate schools, as part of a clinical doctoral program, don't offer an I/O course, understandably. And yet, on the EPPP, there will be 20 to 30 questions from industrial organizational psychology. There's no one area of emphasis called IO psychology on the EPPP because, in fact, all the questions from IO end up getting subsumed, questions here, questions there, in a variety of other different areas, such as treatment intervention would have to do with interventions in the workplace, or cognitive affective would be theories of motivation, assessment and diagnosis would be ways of assessing people in the workplace, etc. And in the biological subsection, about 5 to 10 of your questions are going to require psychopharmacology knowledge, so knowledge of medications, medication side effects, what medications are used to treat different disorders. Okay. You're wondering what's new. This test has been incredibly consistent over the years. So I took it over 20 years ago. And it really hasn't changed that dramatically. The 8 areas are still the same 8 areas. One thing that did change is many years ago, the test was actually much more weighted on statistics, research design, and test construction. So that research methods that I said was 7% of the test was like close to maybe 15 or 18 or 20% of the test. It was just a much huger weighting. So for most people, that was good news when they reweighted the test. And then when they make their changes, they stay pretty consistent for a long period of time. They have given us the heads up, however, that effective August 1st, 2011, there will be a few very minor changes, should really have minimal impact on you, the test taker, in the relative emphases of the 4 domains. So this is not a dramatic overhaul. Biological bases goes up 1%. Growth and lifespan goes down 1%. Research methods, yes, sadly, goes up 1%. And treatment goes down 1%. And that's it. Everything else remains the same. So you're just going to see a minute amount of changes in the questions that are emphasized. Here's the other really interesting thing. As of August 1st, 2011, the test will still remain at 225 items. You'll still have the same amount of time to take it. However, the scored items will now be 175 out of 225, and there are going to be 50 pilot items. I'm actually speculating that that will have very limited to no impact on you, the test taker, because you're still needing to get the same percentage of questions correct. I think they stated that they're doing this because it gives them a bigger pool of items to pilot, and then they have more control over the test and the testing process. There are 4 forms I mentioned of the EPPP in circulation at any point in time. And what they do is about every 6 months, they retire one form and they introduce a new form. So you could see how they stagger new forms of the EPPP. The test is incredibly psychometrically robust, the EPPP. It's really fantastic. I mean, I don't know if you guys will get so excited about this. It's a highly reliable, which I think is a really good thing, a reliable test. By reliable, it means that it's consistent. If you go in and take Form A today and you take Form B tomorrow, your scores will be virtually identical. And the reason I'm so excited about that is that that makes it fair, right? It wouldn't be fair if one form you took and you'd get a 450 and the other a 550 and it was luck of the draw and you went in and you were all prepared and you got the form that was, you know, people scored lower on. So it's a fabulously psychometrically put together test. And I don't work for them. All right, what else? EPPP pass rates from the past 3 years. This is posted on the ASPPB's website. They're the people that oversee it. So they collect the data from all the states and provinces. And what they've done is they've compared students who come from APA or CPA accredited programs. Their pass rate on the EPPP is about 78%. And non-APA CPA programs, the pass rate is, as you could see, quite a bit lower. What they didn't do, of course, on their website is also look at, you know, did people take training programs and how much time did they dedicate to the process, what testing program did they use. Because one thing we're really excited and proud of is that our pass rate tends to be about 90% at Psych Prep. We haven't divided it up based on whether someone came from an accredited or non-accredited program, but we're consistently right around the 90% area. So that was exciting to see. The other interesting piece, so I would encourage all of you, if humanly feasible, the data that ASPPB has published strongly suggests that the sooner you take the EPPP after you complete your degree, the better you score. Now, whether that's because all your courses are still fresh in your mind or what, you're in that student mode, whatever it is, people do significantly better. Now, I'm going to put up this slide and say this is old data, but it's the last data that they provide on their website. So it only goes up through 2000. But you could see the difference between someone who graduated consistently, it's very consistent, and took it within a year of graduation, 2 to 3 years after graduation, and 4 to 5 years. You could see a big drop off. So that's my word of encouragement to all of you. All right, these statistics are specific to California. Between January 2006 and December 2009, posted on the Board of Psychology's website, they post a month-by-month passing rate. And I can't really quite figure out why it would be so variable. But it can range anywhere from 46% of all the people who took the test that month to 81%. And as far as I know, there's no good months to take the test in or bad months to take the test in, because in 2006, January might have been the 81%, and in 2007, January could have been the 46%. So it's not about what month you take it in or what time of the month you take it in. I mean, my bias is it's about being prepared. You want to make yourself failure-proof, be well prepared, and so be one of the success stories. Next are some of the resources for test preparation. So one resource, I think crucial resource, is some kind of formal test preparation process. And I'm not just here to sell psych prep. Of course, we do prepare people. But it's really hard to prepare for this test just on your own, going to read books and things like that. Because a big part of the process is taking practice multiple choice test questions. And that's what test prep programs, psych prep included, offer. So we offer materials, online, full online testing program, CDs, weekend workshops. Also, we're the only company I know of that offers a 14-week live class that you can attend, and we're working soon to also have video capacity so people can watch it all over the country. But at this point, you can actually come to a 14-week structured class to prepare for the EPPP. The ASPPB, remember that acronym from earlier? They're the people who orchestrate the whole test. They have a resource that we encourage people to look into, which is 250 items that were previously on the EPPP. So these are actual test items, no longer on the test. They sell them for $37.50, and they actually tend to be, along with our psych prep tests, very predictive of how you're going to do. So if you take those 250 questions close to when you're testing, you're going to get a good idea of how you're going to do on the EPPP. Let's see what else. And I've given you the link to either call or order if you wanted to from the ASPPB. PES, remember they're the people who run the test. Getting used to all the acronyms here. Along with ASPPB, also offer what they call the PEEP, Practice EPPP. So you get to take a practice EPPP, which is 100 items. You could take it either at the Prometric testing site, and as technology has changed recently, just in the last couple of years, you can actually take it online in your home from, I believe, either a PC or a Mac, and it's $55. So you can register to take that. At this point in time, although I think they're working to fix this, scores on the practice EPPP tend to be significantly lower than the EPPP. So that's a little alarming. We have students who take the practice EPPP and they call the office frantic because we've told them you're in great shape and you're going to get in the 650s. And they go, I just took the practice EPPP and scored a 500. What's going on? And I'm like, you'll still score 650. And indeed, they go take the EPPP a week later and they score 650, 680, 630, something of that sort. So scores really underestimate. The hope is that they're going to adjust that at some point in time, because it's a little defeating, right, to be taking a practice test that you want to have predict how you're going to do, and then you have to add 100 points to the score. But nevertheless, what you get when you take the practice EPPP is you get an overall score, so from 200 to 800. You get a percentage in each of the 8 areas. But what you don't get is you don't get to know which questions you got right and which questions you got wrong. So it's not a learning tool in the same way that taking an online practice test would be a learning tool because you get immediate feedback. Or even that booklet, the 250 items, is a learning tool because they do have the answers at the end of the booklet. So they serve different purposes. What else? There's a listserv. Probably the most well-known listserv is the Yahoo listserv that's specific for the EPPP. And it's just made up of people in the preparation process. So sometimes they'll share bits of information. For some people, it's just can be very anxiety-provoking because people are sharing their anxious stories. And for other people, they're success stories. So it can be very inspiring. All right. Strategies for success, the moment you've been waiting for. We're, unfortunately, due to time constraints, I'm really big on strategies for success because, you know, what's the difference between putting in all the hours, and usually it's, you know, 200 to 300 hours total that people put in to prepare. What makes the difference between somebody who passes and somebody who fails? And the answer is not exclusively how many hours you put in. So yes, there's a critical point. If you put in 5 hours, you're probably not going to do it. But for the people who put in the 200, 300 hours, what differentiates those people who are successful and who aren't? And again, it's not time and it's not effort. And so just to repeat, you guys are all invited at any point in time. You can look on the Psych Prep websites to any of our 5-hour free study strategies workshops where we talk about this for a good 5 hours. Success depends on, we're going to talk about 3 things. The first is huge, developing and enhancing multiple choice test taking skills. We have worked with so many brilliant students who could lecture on a topic, but they're just not good test takers. And multiple choice tests require a particular skill set. And certainly it's a skill set that, well, I tend to believe that it's normally distributed in the population. What that means is some people have been, since preschool or elementary school, naturally exceptional multiple choice test takers. Most people are in the middle, and some people, and you know who you are, have said and will always say, I am just a terrible multiple choice test taker, always have been. They go, always will be, and we go, nope, nope, not the case, not always will be. Because what we found is that you can become a better multiple choice test taker, and that is a huge component of preparing for this test. The second piece is to actually have a plan. I think that makes sense in most aspects of our lives, but to have a study plan and a structured timeline. And I encourage people to have an end point to their timeline, as opposed to the kind of timeline that is, I'll test when I'm ready, because those tend to really drag out. And the last piece is this importance of a feedback loop. You want to be able to, you want to be tracking your progress. You want to be seeing progress. You want to be catching any difficulties or problems that you're having and remediating your problems. And that's it in a nutshell. Again, I could spend 5 hours talking about this. But in a nutshell, becoming a better test taker, having a structured plan, an approach, materials, tests, and knowing where you're at in the process, knowing if you're on track or you're not, and if you're not on track, figuring out how you're going to remediate so that you can get back on track. Okay, the average candidate, I hope this is good news, maybe this feels like bad news, will pass the EPPP by putting in anywhere from 10 to 20 hours a week for 3 to 4 months. So you know, that's no small amount of time. That's like taking on a second part-time job, and we certainly appreciate some people are already working full-time and have a family. But this is really what it takes. And of course, you can, if you don't have this kind of time, you can spread it out over 6 months or 7 or 8 months. It starts to hit a point of diminishing returns if you spread it out over 2 years, for example. So if you all do 2 hours a week for the next 2 years, because you can't hold everything, and part of this process is that you're going to be seeing things over and over again, and you need to hold on to a certain core amount. So that's about typical. And here's our very bold statement, which is the amount of hours spent studying does not necessarily correlate with success. So for all of you statistics whizzes, what that means in simple English, the amount of hours spent studying does not necessarily correlate with success. What that means is it's not the quantity, it's the quality. So to get ready for this test, you're not just logging in hours and saying, good, I did all my hours, that means I'm guaranteed to pass. They have to be quality hours. Okay, so I'm going to spend a couple more minutes, because I'm sure you're all curious about how do you become a better multiple choice test taker. So again, this is the abridged version. You need to have a strategy, and I should add in the word here, an effective strategy for approaching test questions. What I found is that everybody has a strategy for approaching multiple choice test questions, whether you know it or not. So the next time you take a multiple choice test question, you may want to focus on not, did I get the answer right, but what was my strategy? Everybody has a strategy. I'll share with you the most common strategy, which is not hugely effective for people, especially in difficult content areas like stuff for the EPPP, is that they'll take a question, they'll read the question, and they'll go, huh? And then they'll go, let me look at the answers, in the hopes that something springs out. And they read their 4 answers, and they go, wait a minute, what was the question? And then they go back, and you go through this cycle of like not really knowing what the question was, not really knowing what the answers were. So that's not going to work for this test. So you want to really develop your effective strategy for approaching multiple choice test questions. I'll share with you, this is just a little anecdote of a woman I did private consultation with who had failed the EPPP twice. And she failed, and this is what's so very, very interesting, is that when people take the EPPP more than once, and you fail, if you do the same thing, you will get the same score. So I have known so many people one woman who got the same score 5 times in a row. Not the exact same score, but within a question or 2. This woman had taken it twice, and she missed by 3 or 4 questions, and we were doing some private consultation by phone. She was actually in New York. And she said, I'm just one of those people who've never been a good test taker. I said, okay, well, we'll work on that. That's the whole idea. And very early on, we were talking about this concept of what is her strategy. And very early on, as we were talking about I gave her some sample test questions. We were doing them over the phone and asking her to get a window into her strategy. She said the most curious thing, which I found very funny and interesting. She said, I figured out what my problem is, which is always great, right? If you have a client and they figured out what their problem is, you're halfway there. I said, good, what's your problem? She said, I've been using the supermarket strategy to test multiple choice test questions. I said, the supermarket strategy. Now there's one I've never heard of. What is the supermarket strategy? And she said, I was picking my answers kind of like I pick a cake out of the bakery case in the supermarket, or a can out of the canned goods section. She said, I was picking my answers because it just felt good, looked good, seemed right to me. So she would see the answers and she goes, that one appeals to me. But she really didn't have a deeper basis to why it appealed to her. And a lot of the time, it was very appealing but wrong. And so that was like a breakthrough, and we really worked on test taking. So again, you want to have an effective strategy, window into your own strategy. One of the biggest things to become a better test taker and to prepare for this EPPP process is to get excited about the learning. Particularly, not just all the new stuff, but to get excited about your mistakes. I'll share, there's this fabulous book I stumbled upon a couple of years ago called Mindset by a psychologist named Carol Dweck. And she's done some interesting research across kids, athletes, CEOs of corporations, etc. And what she finds and reports on in her book is that basically people, learners, have one of two mindsets: a fixed mindset or a growth mindset. And she's seen this from like 3-year-olds all the way up to 80-year-olds and across all areas. And the fixed mindset is one in which if you get it wrong, to you, it means you're not smart. So it's like you know it and you're always having to prove yourself. And getting something wrong means not good. They're going to find me out. And a growth mindset are the people who are excited about getting things wrong because they're excited about the learning process. That if I got it wrong, great. I struggled with it. I got it wrong. What can I learn from this? And they just get excited about getting things wrong. So I would encourage people to to adopt that growth mindset in this process and get excited about your mistakes and learning from them. Because I'll tell you what the bleak alternative is. The bleak alternative is we get students who, again, you guys are doctoral level people, so I think you're in the top 0.1% of the population in terms of education. And you start out preparing for the EPPP and you take your first practice test. Again, you have your doctoral degree, you've studied psychology. You take your first practice test in your field, not a different field, psychology, 200 questions. Most people score between a 90 and 110 out of 200. That is 45 to 55%. Very humbling. Now, the alternative is to be just depressed, angry, irritated, frustrated, blame your graduate school, blame the test makers, whatever it is. But if you can get excited about that learning process and go, oh, this is really cool, and I'm going to really build my repertoire here, and it really makes a huge difference. So those are your two options, because no matter what, you're going to start with a really pretty low score, and you're going to build your way up. So either you can get excited about it, or you can get frustrated and depressed about it. So to be a better test taker, we want you to be excited and learn from your mistakes and educated guesses. What they've found, which is so interesting, is that people learn much more from what they do wrong than from what they do right. You get it right, you're ready to move on. You get it wrong, if you can maintain that curiosity and interest, you're like, where did I go wrong here? And why did I pick this? And what was I thinking? There's so much to learn from your mistakes. And the last part of being a better test taker is a lot of practice. For years and years, ever since we started Psych Prep, we have encouraged people, which maybe feels like it goes a little against the grain, to start taking practice tests through our online testing program before they even do any studying. And we get resistance because people say, what would the point be? I'm just going to miss them all if I haven't done any studying yet. So what would the point be of taking tests? I want to do studying so that when I take the tests, I can do better. Well, again, it turns out that by taking practice tests and starting with them early on, you become a better test taker. You could do reading from now till 3 weeks before you're ready to test and then start your testing program. You're not going to be a good test taker or a better test taker. So you develop your test taking skills. You also, by taking tests early, get to know what tends to be emphasized on this test. How are questions going to be asked on this test? And additionally, again, there's a lot of new research suggesting that this is the approach. If you want to get people to learn, give them the questions in the beginning, have them make all their mistakes, and they're actually going to learn a whole lot more. So we're really big fans of getting going on the test-taking process very, very early on. And what's very exciting, again, about test-taking skills, what we've seen is that regardless of where you've been on the bell-shaped curve, and most people have been in the same spot for most of their lives because you haven't been trained to be or taught to become a better test taker. Regardless of where you start out, we see huge amounts of growth. I didn't tell you the end of the story of the woman with her supermarket strategy. We did 3 or 4 consultations. She also did our online testing program very quick. I would say she probably didn't put in more than, I don't know, she didn't have a lot of time because she was testing 2 or 3 weeks later, so she put in, I don't know, maybe 50, 60 hours. She went from missing the test by 3 or 4 questions twice to improving her score to where she exceeded the cutoff by over 20 questions. So in scaled score terms, she went from like a 475 to like a 610, which is huge in a short amount of time. And it was all from becoming a better test taker. And she felt a lot better about herself too, because she also said, oh, I never thought I could do this. Now I'm actually, she was way above the curve by the end of this whole process. Okay, so test taking, becoming a better test taker. In terms of structuring your study time, the research has found, and what we encourage people to do, is that you're going to learn more effectively if you're able to space out your practice rather than mass your practice. So what does that look like? If you have 10 hours a week to study, you're actually going to learn more if you're able to study an hour a day or 2 hours Saturday, 2 hours Sunday, and an hour during the week than doing all 10 hours on Sunday. Our brains just don't work that way. It's just too much to get in. The optimal learning strategy is overlearning. Overlearning is like you're past the point of mastery. I encourage people to get to the place where they feel like they would be happy to provide the lectures for the EPPP, and/or they would be comfortable explaining this to interns that they're supervising. So every concept, every question, when you're at the level that you're comfortable explaining it to a colleague or a peer, you know it at that level. We encourage people to alternate practice and content. So there is a set amount of content you're going to have to get through. But again, we say don't do all your content first, then your tests. You're going to be integrating in back and forth. And to avoid getting bogged down in difficult domains. Very important. We've seen that some people, because they're not familiar with a domain, devote inordinate amounts of time to that area. So someone says, oh, I'm weak in statistics, so I'll spend 50% of my time studying stats and research design and test construction, but it's only a small subset of the test. So you want to give it, each area, its fair due. The last thing, which Psych Prep suggests, what we suggest, which is a little bit controversial, especially if you're used to doing this in graduate school, is to avoid making tons of flashcards, outlining and redoing your entire study volumes, creating elaborate tables and charts. So why? Because you can create a flashcard, but a flashcard is a dictionary definition of a concept. The EPPP, I guess fortunately or unfortunately, does not test straightforward definitions. It's a hugely applied test. You have to know what something will look like in clinical practice or how it'll present in the room or et cetera to be able to get the test questions. So, one of my, I don't want to say favorite calls, one of my, I guess, most distressing calls was from a woman who, prior to contacting us, had created 3,000 flashcards and failed the EPPP. So clearly it's not about flashcards. It's about your capacity to think on your toes. And you need to know the basic concepts, but I always use the example, if any of you were in a diagnosis class, read in the DSM, and discussed what it's like to work with a patient with borderline personality disorder, so you know the criteria. But once you've actually had the experience with a patient with borderline personality disorder, you don't really need to go back to the book. It's like you know what the experience is. And it's the same thing here. We don't want you just to have lists of things that you're memorizing. We want you to really know what that would look like in application, how this reminds you of the real world, your patients, your kids, people that you know. Okay? And the last thing, and this may be premature for those of you who aren't going to be testing for the next 3 or 4 years. However, for those of you who are close to testing or just want an idea of this whole tracking process, very important to track your progress. The most important thing is that we encourage a process of taking as well as retaking tests. So you take a test for the first time, you're also going to be retaking tests. In fact, retaking things twice, so that you're taking every single test question that's offered 3 times. Seems to be optimum for most people. And just in a nutshell, what you should see as you progress from test to test your first time, so we call them A through E, is you should see your scores getting better and better the very first time you ever take a test. So as I said earlier, most first-time takers are between a 90 to 110 out of 200. By the time you get to D and E, your first-time scores should be in that 130 to 135 range. So you're going to really be getting better and better at taking test questions for the first time. Our tests are progressively more difficult, not easier. So now we're expecting you to get higher scores on more difficult tests. This D and E of 130 to 135, if you opt to use Psych Prep, is hugely predictive of passing the EPPP. If you're able to get those scores first time, it's like 99.9% you will go on to pass the EPPP. We encourage people to retake tests, and there's also criteria when you're retaking. So if you retake a test, we hope, there's no way, you wish, we all wish, that you go from getting a 110 to getting a perfect 200. It just doesn't happen. But what we strive for, or have you strive for, is to make no more than half as many errors as you did the first time. You're not going to, it's such a wealth of stuff, information and test taking and all of that, that there's no way anyone can retain everything from one time to the next. But it's an incremental process. And if you're able to make half as many errors the second time, you're in good shape. Okay, that was it for the EPPP. Test taking, all the information. We're going to spend a little bit of time talking about the CPSE. There's a lot less to say. And then I'm going to open up to you guys for any questions that you may have. So the CPSE is California specific. If you're in another state or province and want to be licensed, you will have to take the EPPP. You may or may not have to take a second test. The second test could be a written test. It could be an oral exam. Or there are some states, New York is one of them, for example, where once you pass the EPPP, you can get your license immediately. In fact, one student had some delay in getting her EPPP results before now they do it on computer, but they used to send them in the mail. And so she was waiting and waiting and very anxious, and then she emails us to say that she passed the EPPP because she got her New York license in the mail today. So she never even got her score. Her license arrived before her score did. So again, that's just some states. The CPSE. All right. The CPSE came into effect on January 1st, 2006, and it looks like it's at least here to stay for a while. It replaced its predecessor, the CJPEE, which I'll explain in a minute. So the CPSE, the California Psychology Supplemental Exam, replaced what was called the California Jurisprudence and Professional Ethics Exam. The California Jurisprudence and Professional Ethics Exam was all questions related to law and ethics. The CPSE is a broader test. It has a subset, 40% or so of the questions are law and ethics, but it covers 4 domains, which we'll talk about in a minute. If you know people who were licensed a way long time ago, prior to the CJPEE was the California oral exam. So the oral is gone, long gone. Then came the CJPEE. Now is the CPSE. Okay. We're going to talk about some of the same issues: application process, test administration, emphasis, areas of emphasis, resources, and statistics. Okay, here's what's interesting if you're getting licensed in California. There is no application required for the CPSE. So a lot of people are confused because they scour the board's website now that they've passed the EPPP for the CPSE application, and there is none. All you need to do once you pass the EPPP, assuming you've then submitted your total of 3,000 hours of SPE, you're now eligible. What you need to do is send in your exam fee, which is currently $129, to the California board. So unlike the EPPP, where you paid your exam fee to PES in New York, for the CPSE, you're going to send in your $129 exam fee to the California board. Say, I passed my EPPP, you have all my hours, I want to test. Like, there's no form or anything to fill out. You just send them the money, let them know you want to test. Keeping in mind that the board can be swamped if you're pressed for time to take the CPSE. So for example, you took the EPPP on the 15th and you know you're going to get your results on the 18th and you're expecting to pass and you want to take the CPSE pretty quickly. You can actually send in this exam fee weeks or months prior so that they've processed it and you're good to go. It just speeds up the process if you're eager to take the CPSE. So within 1 to 2 weeks of submitting the exam fee, again, assuming this is after you pass the EPPP, you get this eligibility to test email or letter from the board. And the CPSE is offered at a different testing site than the EPPP. It's called PSI. So that's their information. There are far fewer PSI sites than there are Prometric sites. The CPSE is computer administered, as is the EPPP. The CPSE is 125 questions, multiple choice, 4 choices per question. 100 questions are scored, and 25 items are pilot items unscored. Once again, you don't know what the pilot items are. One thing that's true of both the CPSE and the EPPP in terms of this multiple choice format that's different, for example, if you took the GRE and the SATs, is that there's no penalty for getting it wrong. So the strategy is really different when you take the EPPP and the CPSE than if you were taking a GRE or an SAT exam, because those exams penalize you for getting it wrong. So if you get it wrong, not only don't you get the point, but you lose extra points. That is not the case. So any item you get wrong, you just don't get a point. So you are highly, highly encouraged, even if you see an item and you go, I really don't think I have any idea here. It could be any of the 4, to answer it. You don't want to leave anything blank. Effective February 1st, 2009, so that's very current, all the items on the CPSE are what we call standalone items. Prior to February, February of 2009, the CPSE was a very complicated test because they had some standalone items and then they had some items where it was a very large vignette with 3 follow-up items, but each answer to each item had 4 choices to it. It was very confusing. So answer 1 had 4 choices, answer 2 had 4 choices, answer 3 had 4, and then you had to pick the answer with the best 4 choices. Very confusing. They simplified things, thankfully. So every item is a standalone item. 1 item, 1 answer. They give you 3 hours to complete the CPSE. So in a way, if you look at prorating for the number of questions, that's actually quite a bit more generous than the EPPP. I think this is actually really an old standby from when they had that much more complicated format. It took people forever to get through those questions. So they simplified the test, but left you 3 hours to complete it. So most people do not have timing issues with the CPSE. The CPSE, unlike the EPPP, there is 1 form in circulation every 6 months. 1 form only. And the 6-month period will go, for example, from August 1st to January 31st, and there'll be one that goes from February 1st to July 31st. And it's always timed that way. So if you take it in this period and your friend takes it in this period, you have to be getting the exact same form of the test. There's only 1 form. At the end of that period, a new form is introduced. And that's the form that's around for the next 6 months. Here's what's different than the EPPP. The CPSE, being a California exam, has a variable passing score cutoff. And it depends on the form of the test that you're taking. And it's ranged anywhere from a low of 67 out of 100 to a high of 77 out of 100. And you would think that the 67 would have been a much harder test and the 77 a much easier test, but that is not always the case. So the cutoff becomes available the day the new form comes out. So the board will not let us know in advance what the cutoff is, but on August 1st when the new form comes out, you can find out what the new cutoff is. The current passing score cutoff, if anyone's testing anytime in the immediate future, is 73 out of 100. Unlike the EPPP, when you take the CPSE and you submit your results, your score results are immediately available. They don't show up on the computer, but when you go into the next room, the woman at the desk or man at the desk gives you an envelope with your score results. One thing about the CPSE that's kind of interesting that was changed from earlier on is that if you pass the CPSE, your paper will say pass, and you won't get a score. So you won't know if you passed exactly at the cutoff or 15 points above the cutoff. If you fail this CPSE, they will tell you your score, thankfully, because then you know, did I fail by 1 point or 10 points, so you know that you're closer. Here is the bad news about the CPSE. So there's a lot of good news, meaning it doesn't take a huge long time to study for. It's a pretty reasonable test. The fee is less expensive. The bad news is that if you fail, you have to wait 6 months to retake the CPSE. Now, people have cleverly come up with the idea, which would be if I take it in January, for example, and the new form comes out in February, maybe if I take it in January and fail, I could take it in February, and that'll only be a month, because there's a new form, and there's a new form every 6 months. Well, that doesn't work. It doesn't matter that a new form is already out. You have to wait 6 months, if that makes, that's what the rule is. So this is a test that you want to feel very, very prepared for, because 6 months is really painful to have to wait. The areas of emphasis on the CPSE are these 4 areas. So legal ethical is specific to the ethics code, but much more specific to California law. So it would not be stuff that you study for the EPPP. Crisis assessment intervention doesn't really overlap a whole lot with the EPPP. What they're looking at is they give you different scenarios, and you have to decide, would you put someone on a hold, or would you call the PET team, or does the psychiatrist need to be contacted immediately? Things about like how would you handle and intervene in a crisis. Clinical assessment and evaluation are things related to diagnosis and testing, so that does overlap a good amount with the EPPP. And treatment interventions looks at interventions for different disorders. Particularly, they're interested in what interventions are empirically validated for the treatment of different disorders. So those are our areas of emphasis. And for legal ethical standards, they say they come from the laws and regulations relating to the practice of psych, the summary of California reporting laws, and APA's ethics code. All right. Resources for preparation. Oops, sorry. Would really, there's no like practice CPSE tests that you can take or practice test questions. Really, it's your main resources are the different formal programs, of which Psych Prep is one, and we offer comprehensive home study, online, CDs, weekend workshops, things of that sort. Some statistics. Between February and December 2009, passing scores have ranged from 53%, that's really low, to 98.5, really high. With the CPSE, some of it, unfortunately, does, although I think they've evened out a lot of the kinks, does depend on which form you get. So when the scores were 53%, that was the lowest for the given 6 months, but all those scores were actually in the 50s and 60s for that particular form. They've done a much better job, and obviously 98.5 seems unbelievably high for a given form that only 1% of the people are failing. I think it's gotten a bit better now in terms of them determining their cutoff, and it's probably closer to about an 80% pass rate for people taking this, well prepared and taking this CPSC. Okay, just a little bit of information on what Psych Prep has to offer, and then I am going to open it up to questions. For the EPPP test prep, I mentioned earlier, everybody is invited to our free study strategies workshop. And so really, in this workshop, we'll talk about multiple choice test taking, how to study your content, structure your study time, how do you monitor your strengths and weaknesses. We offer 3 what we call premium packages. And our premium packages are the most comprehensive package. They include all the components. And people do fabulous with these packages. The A package involves live attendance at our 14-week class. So if you're in the LA area and like to come to class each week, that's a great option. All the premium packages include all the components. So they include your study volume, they include the online testing program, they include a weekend workshop, and they include either coming to the 14-week class or in another one of the premium packages, the CD set that was recorded live at that 14-week class. So package B involves not attending class but getting the CD set and coming to the weekend. Package C is an entirely home study program, home study based. So the workshop is a home study, the class is a home study, you have your tests and you have your materials. So those are the most comprehensive programs. And then we certainly offer options where you can just get pieces. So if you're somebody who just says, I just want the online testing program or just the study volume and online testing program, that's available as well. If you're a group of people who are getting ready, a group of friends getting ready to study, we do like to discount those kinds of programs. So if you want to get together a group of people who are studying more or less at the same time, that you don't have to all order like within a day or a week, but let's say within a month time frame, we offer a discount. Giving you our website, very easy to remember, psychprep.com, and our office phone number. In terms of the CPSE, just a number of different options. The preparing for the CPSE takes way less time. What I didn't say is the EPPP takes 3 to 4 months. Most people prepare for the CPSE anywhere from 3 weeks to 6 weeks. So 6 weeks is at the long end. And with the EPPP, it could take people up to 6 months maybe. Way less to study and less expensive too. The programs are less expensive because it's less material. There's no 14-week class. There's weekend workshops and things of that sort. And information on our website. If you just want to see what some sample test questions look like, you can, for the EPPP or the CPSC, you can just go to our website, click a link, and see some sample test questions. And our last slide here. Just inviting you to work with us so that we can help see you through this final piece of your journey. It's really pretty incredible to, all the steps that it takes to get a doctoral degree. I'm sure you're all proud of yourselves as you're moving through that process or there already. And again, how important it can be to you professionally and personally meaningful to get your license. Past this slide are just a number of comments from participants, so I don't think I need to go through those. I think I'll open it up to questions at this point in time.
Okay, Dr. Jabon. We do have a question. Actually, we had several questions regarding the presentation itself and the PowerPoint. Just to let everybody know, these will be available online once the recording is published to our website. So notice will go out to all attendees, just so that you know. PowerPoint and the recorded presentation will be available at a later date. We do have a question from Rhonda. She wants to know if there's a list of approved places and or workshops to help prepare. So if you know of a resource that provides a list of approved resources.
Is she talking about specifically to prepare for the exam?
To prepare for the exam.
Okay, great. Yeah. So there are no approved resources. If there were, we would hope to be one of them. But if you contact any of the state boards, they'll say, no, they don't specifically endorse or approve of any specific programs. there really is a limited number of programs throughout the country that offer comprehensive preparation for these tests. So Psych Prep is one of them, and you can just easily Google EPPP test prep, and you'll come up with like 3 or 4 handful of other companies.
Okay, perfect. Thank you.
You're welcome.
Are there any questions from the audience? Okay, hold on one second.
Sure.
If you'd like.
My name is Jerry Lynn Arias, and I just have one question about
Sure.
preparing for the exams. The online testing, do they provide a rationale of why you got the question incorrect?
Okay, that is a fabulous question. Yes, so one of the strengths, and in terms of feedback that we've gotten from students about our program and the online testing program, is that for every test question, there's a very detailed rationale. The testing program is set up so that you can take the test two different ways. One is what we call in a study mode, where you get 1 question, 1 answer. The other is in a full test mode, where you take the entire test, submit it, and then you get all the feedback afterwards. That's a really important issue because a huge part of the learning process comes from studying the rationales. And what we focus on in the rationales are not just why the right answer is right, but why each of the wrong answers are wrong. And we encourage you, the test taker, to really know why each of those wrong answers are wrong, because especially the one you picked if you got it wrong, like what is wrong about this, but also because any of the wrong answers can become the right answer to a different question. So what we say to people is on a given 200-item test, really there's like 800 concepts you're learning because there's 4 answers to each question. And so there's a wealth of information on a given test.
Does that also mean when you're correct that it gives you a rationale for what the correct answer was?
Absolutely.
Okay.
Yeah.
Because I find that very helpful.
Yeah, it'll tell you why your answer was correct
Mhm.
and why all the incorrect ones are incorrect as well. Thank you. Sure.
Okay, perfect. Are there any you have a question? Okay, I think that... Oh,
Just a general question.
okay, Dr. Allen.
I took my test many years ago,
Me too.
and at that time, I could carry 3 psych assistants,
Yes.
but a psychiatrist could only carry 2.
Okay.
Has that changed?
Okay. So this is a question related to psychological assistance. And currently, a licensed psychologist can have up to 3 psychological assistants. One thing that has changed, because you talked about doing this many years ago, is that to have a psychological assistant, in the past you needed to have been licensed at least 3 years, and then you could take on a psych assistant. Right now there's no time requirement, so that's another advantage to getting licensed, is the minute you get licensed, you can take on psych assistants. So you can have up to 3 as a licensed psychologist. Psychiatrists, they actually only allow 1. So I'm not familiar with if years ago it was 2 or when they changed that. But it is only 1. So a board-certified psychiatrist can have only 1 psychological assistant at a time. What I didn't say is that if you're a clinic or a corporation, you can have up to 10. So that's the cap for a clinic or corporation.
Okay, are there any more questions? All right, then thank you very much, Dr. Jablon.
Thank
We
you
appreciate
so
you
much.
joining us this afternoon, or this morning, I should say. And again, for all those out on the internet, this recorded presentation will be posted at a later date. If you have any questions, please feel free to email me at dsampica@calsouthern.edu, and I'll be happy to answer any questions at a later date. Again, thank you very much.
Can I add
Oh,
one more thing?
absolutely.
If anyone has any specific questions about psych prep, as I mentioned, you can contact the office, but you can also email me, so it's pretty easy. It's sjablon, all one string, so S for Sharon, Jablon, @psychprep.com. And just mention that you're from Cal Southern and saw the presentation, and be happy to answer any questions you have. Okay.
All right, thank you very much for attending this afternoon.
Thank you.